Welcome to the BrickBoxPodcast. Hey, what's up, everybody? Talking all things production. Okay, for talent and crew, made by talent and crew. That's right. So, all right, Chuck.
Oh, you mean they don't want you to have free will?
Which is kind of why I continue to be here.
And sometimes we go off topic.
Oh, look at that!
Okay, and then everybody should see a light. Does everybody see the light?
Yep.
Okay.
I'm always looking for the light.
Yeah.
I don't. What light are we talking about?
It's like when you die, I think you see the light or something.
Yeah, I think that's also. I should look for the light.
I don't know.
Don't go toward the
Oh,
light.
well, we're recording. So,
Oh, I see. Oh, that little light, the little red ball.
yeah.
Red ball.
Yep. So that when that's on, you're on. So.
I got some.
Okay, cool. So I'm glad you guys all could be here. This is amazing. And so I want to kind of go around and we'll just introduce ourselves, and then the sort of the reason for this before I begin is just sort of like you are all experts. You're all people that are in the field, the medical field. You're all people that are directly affected by what's happening and have working knowledge. I think right now the conversations that are having specifically like on Facebook and all of that, it's sort of everybody's hearing something and then it becomes the echo chamber and nobody is really really an expert on it. So it's important that, you know, we say that, and then I make the blanket statement, of course, that, you know, anybody here who might be in a union or affiliated with an organization, nobody here is speaking on behalf of that organization. This is an unofficial, impromptu, just chat. So so let's go around, and Dr. Paul, if you'd like to go first.
Sure. Paul Heinzelmann is my name. I am a primary care, urgent care doc at MGH. Currently doing 1 day a week in the respiratory clinic, seeing COVID patients and other suspected patients. I've done some training in public health with focus on international health, and some training in telemedicine. In 2007, I started a small business called SetMD. And since that time, we've provided services to over 150 productions. Most of it is cast exams, house calls, increasingly more telemedicine visits, also some technical advising, and then things like flu clinics and things like that. And I'm anxious to find out how the new era of coronavirus is going to change what we do, and hopefully find ways that we can make some contributions.
Awesome. Chip, you want to go next?
Yeah, hi, I'm Chip Carriere. I'm in Mandeville, Louisiana, actually, which is about 30 minutes north of New Orleans. I probably have my kind of experience is I'm not an MD, but I too, like Dr. Paul, I manage 8 urgent cares, and I've been in them every single day, it seems like, since this mess started. And I too am seeing stuff that's being put out on Facebook and everywhere else that's just not matching up to what I'm seeing in the clinics on a daily basis. And, you know, I don't know if I told Chuck this or not, but like our Slidell clinic is our busiest one, and the last positive we saw in there was April 19th, and we're doing probably 10 to 15 tests a day in that clinic. So it's kind of been a little interesting and a little wonky when it comes to the numbers that you hear about out in the public. So,
Yeah.
Roger, you want to take the floor?
Yes, Roger Dillingham. I work locally as a set medic. My EMS experience, I've been EMT coming up on 29 years, 17 years into rescue, and then I converted over in 2007, 2008 to continue EMSing with the film industry, and also working with Dr. Paul, like I said, in the various clinics that he's come to set with. I think between the flu shots, the B12 shots, the general purpose injuries that we've had with different actors. So we've been able to really work hand in hand on set, and now with this new onset of changes, it's really stepping up the scope of our awareness to educate people in the right reasons. Like Chip said, the things that you see on social media as a broad spectrum is either diluted or it's misinterpreted, and people take that, call it that TCBY spoonful, and run to the hills with it, and realizing that they left a whole plate of information that is paramount to the bigger picture that most people just aware of. So in collaboration with this and various meetings, and we're all just trying to be as aware and educate the people that we interact with more so than anybody else does.
Jill.
Hey, Jill Taylor. I'm also a set medic, construction medic, as Roger is. I haven't been doing it as long as he has, though I've been in the film industry for about 20 years. I worked in the AD department for many, many years, got to know everybody that way, and recently converted over to being a set medic. So I've gotten to wear many hats. I'm also in SAG, as Chuck is. So I've gotten to see it from the, production assistant point of view, the background person perspective, as well as set medic perspective. So I know a lot of the ins and outs of what has to happen on set and where like points of failure could be. And there's a lot of things we'll have to tackle to, safely go back to work. And I'm really curious how we can actually implement that. I do know that I was working on a show right before this became bigger. And I kind of saw the writing on the wall, and I was trying to educate people as much as I could at work with my construction crew. And they were all starting to really understand the importance of, like eating well, wiping down all your surfaces as much as possible. I was pumping everybody full of vitamins and explaining how respiratory illnesses work and everything. And so I feel like they really took to it very well, actually, and they learned a lot, and they were willing to like talk about it and understand how it all worked and everything, because regular people don't know as much. But they weren't like averse to learning, which I think is good. So I'm optimistic that we'll be able to figure out something that will work. But I'm curious how exactly we're going to do this. So.
Well, let me just say thank you all for being here, of course, and for your time. So I want to start with Dr. Paul. Just real quick, can you explain what COVID-19 is, what sort of the virus itself, how like that operates?
Sure. Yeah. I mean, so late December, China started reporting some interesting cases of viral illness that were unexplained in the Hubei province in the Wuhan area. The number of cases accelerated pretty rapidly, and then in February, we started getting cases in the US. Coronavirus is what's called an RNA virus. And it turns out there's actually two different types. There's they identified over 100 strains of COVID-19, but there's two types, an L type and an S type. The outbreak initially was one type, and it's sort of in Europe has a different type. The implications of that are not entirely clear, but it could explain some of the differences that we're seeing when we look at what's happened with it. Typically causes a respiratory illness. The classic symptoms are fever, shortness of breath, sore throat, runny nose, nasal congestion. Over time, the list of symptoms has just continued to grow. So now loss of sense of smell, chills, body aches, diarrhea are all falling under the umbrella of potential symptoms. We're seeing some weird stuff with kids that sort of a system-wide inflammatory response. Luckily, most of the people that are affected are older. About 80% of people get a mild illness and they recover. 15% or so get what we would call serious, and those would be like pneumonias. 5% end up with very serious complications like acute respiratory distress syndrome, and they end up in ICUs. And then, just the uncertainty about the characteristics of the virus and how to treat it and how to test for it have created dilemmas for people who are trying to plan for reopening. And those are, not just for the film industry, for everybody. Those are the things that, to me, are still big challenges.
And now, Chip, you're in the clinics, and you're now, I don't want to get too political on it, but you're able to see, like, you're able to test people are coming in, you have that ability, your firsthand, your temperatures and all of that, you're there?
Yeah, I'm here. Yeah, I mean, like Dr. Paul said, I think the biggest thing when this first started out was the testing. You had everybody and their brother coming out with the next best sliced bread of tests, and many of them weren't FDA approved. Some had FDA rush approval, but they weren't. You couldn't necessarily run them in a CLIA, which I don't know if y'all are aware of CLIA environment, but like a typical urgent care, we're CLIA waived, but they have like CLIA moderate and I think complex, Dr. Paul.
Yeah,
and
something like that.
Some of these tests were only cleared to be run in complex labs, which urgent cares couldn't do, and then it ran a whole gauntlet. We started out from day one using the Quest nasopharyngeal swabs, and we stuck with Quest and another lab called Clarity, which was interesting. Clarity, when you got the test back, it ran a whole gambit of stuff. It was flu strain. We saw a lot of people that were exhibiting the symptoms that came back that had typical RSV, which was kind of interesting. And so it was the ones you really expected to be COVID positive weren't, and the ones you expected not to be COVID positive were. And so we had about 78 employees that worked throughout the whole thing from day one, and we only had 2 that actually ended up coming down with COVID-19. And I mean, of course, like anything else, you don't know if they got it in the clinic or they got it at home or anywhere else. So we had initially a good amount of positives throughout our 8 clinics, but it drastically fell off once people started paying attention to cleanliness and paying attention to the hand sanitizer, wiping things down and all that. And I mean, I don't know, Dr. Paul, you've probably seen too, like right now, we don't have hardly anybody coming into the clinic that has strep or flu or anything else. And I think that's just a statement of how the social distancing and the cleanliness has helped so far. I mean, where we lost all of our respiratory patients, we picked up people with cuts, sprains, because they're all at home doing stuff and working in the yard. We're getting a lot of poison ivy and everything else. So it's kind of been interesting to watch it kind of lay out and fall out throughout the whole thing as to how we're just, I mean, to put it bluntly, we can be kind of dirty people. It's like we probably don't wash our hands enough or sanitize enough and everything else.
My favorite line: people are gross.
Yeah. So I'm encouraged by that. My concern is you have, and Chuck might have seen this, that I said, you've got people that play doctors on TV that may very well determine how we move forward out of this on set and as actors. And I'm just not the doom and gloom type like a lot of them are. I mean, I think people are smarter than that. Yeah.
And let me hybrid that to Roger, if you will. And just what your experience, your onset, being a medic, and Jill, you can probably jump in on this too. Just sort of like, what was the impression right before the pandemic, so to say, and then what has been the impression so far with people you've talked to about, sort of moving forward on set?
Well, prior to this, like with anything, when something comes up of an infectious situation, that we already had a vaccine in place. And I think as Joe Latessi, Dr. Paul, people say, hey, I got the sniffles. What do you have? You got a cold. And we run down the list of whether ephedrine, aspirin, Tylenol, Dayquil, NyQuil, some kind of quill, give me a Z-Pack. And And then within a matter of hours or days, they feel back to 100, as well as telling them, get your rest, take your vitamins, and all these things. Now, as this started to manifest itself, and we realized, hey, as I use the expression, the planet of the apes, we're going into the forbidden zone. We're going into something that we've never dealt with at this level. So the instantaneousness of having a remedy available for us on set to reach in our bag to say, here you go, you'll be fine a couple hours or days, is fearful, because now people are like, well, what do we do? And now let's all take a step back. And the basic was, let's start with something that we've been learning since childhood: wash your hands, which, as you know, people on set run around, grab everything, they sniffle, wipe their nose on their sleeve, they cough, or whatever it is, in the sake of, we're under the crunch of the time clock. So we go, and then, as you know, one person sniffles, gets a cough on set, and then it's rampant, and the next thing you know, a good percentage of the crew is sick. So because this was something that was unknown to us, everybody was hyper vigilant about being precautious, washing their hands, covering their mouth, wearing a mask, wearing the gloves. You couldn't spray enough Lysol, enough bleach, ammonia, not at the same time, to be as careful as we were. And then realizing that it wasn't affecting just our community, but it was affecting the planet as a whole, is when everyone started realizing, let's just stop, let's assess what we're going through. And then as each day grew, and like I said, with Jill, production shut down with the attitude of, until this really gets resolved or solved, we have to stop. So now it's playing the waiting game with the powers that be in the medical field to try to come up with a definitive, we'll say, vaccine that can work with this ever-changing virus that just seems to mutate every time you catch up to it. It takes off again. But I think as we're doing the precautionary things as best we can, is at least putting the pawns on the board to fight the battle as best we can. And like I said, and Jill can attest to how things were on her set that she was dealing with as well.
Yeah. There was definitely a lot of, I agree with everything that you just said. There was a lot of, sets are very dirty places. People are in a rush. There's a crunch. You're absolutely right. No one has time, or the bathrooms are a mile away. And it's bad. People are sharing tools. One person gets sick, the whole crew gets sick a lot of times. But as this started to become more of something that everyone on set started seeing in the news, I've never been more busy, because I had so many people coming to me asking me questions, which I thought was awesome, because a lot of times people just don't do that. So it was really cool that people wanted to know more. And I feel like there's a lot of fear. And even if we do have a good plan in place to go back to work and safely, whatever work is, whether it's on a film set or anywhere else, I think education is key. Having people understand what they need to do. And I think that's the number one thing, is that they are afraid, and there's not quite the proper knowledge out there in the general public. And I think that that's a big hurdle to get over. But as long as we have people giving out the correct information and it's getting to everybody, I think we can move forward with that, even with a vaccine, without a vaccine. Whether we just have an effective treatment, I think that would be good, because it's still kind of all over the place with this works a little, that works a little. So even if we don't have a vaccine, if we have something that does treat the multiple different things that happen to different age groups, the biggest part of this beast is that it does so many different things to different people that you can't it's not just one simple thing that you can try to hit. So it's,
and even now the fear is, we have the allergy seasons coming up, which mimics, hey, I've got the sniffles, I have a cough, my eyes are watering, and so now you may say, listen, all I need is, my Allegra and I'm good, versus, okay, something's wrong with you, hey, throw them in the plastic bubble and off they go. So now we've got to deal with those scenarios as well,
right.
too.
Yeah,
I can tell you, actually,
I cough every morning for 2 hours after I take my Flonase, so they'll be like,
right.
Yeah.
What's interesting though?
Cold to have the same thing happen, where everyone was like, "Oh, you have a cold, you have a sniffle, that person needs to go home," and I was like, it's I could send her home, but she really only has a cold. I'm 100% sure of that. But people are going to start being like pointing fingers at other people of like, that person's sick, they need to leave immediately. So it's going to get a little weird with like interactions, I think, like interpersonal things at work will be interesting too. If someone just has allergies or whatever.
So let me ask you, Dr. Paul, when it comes to that sort of thing, you know, we're hearing a lot about maybe temperature checks before people get to set. You know, what are your feelings about that as far as, you know, how effective is that? Obviously, if somebody comes to set and they have a fever, then that would be a clear indication, right? But since a lot of this can be asymptomatic, it may not be the 100% fix, correct?
Yeah, no, you're absolutely right. One study estimated that 40-something% of people with COVID actually end up having a fever. So it's probably still going to happen because you know, if you think of it like a test, it's not very sensitive. However, it's one way to sort of keep someone who's potentially sick with COVID away from the group. The other kinds of things that are being talked about and that are used in other settings are health declarations, where every day a person will declare they don't have a fever, they don't have a cough, they don't have a sore throat, they don't have a runny nose, chills, body aches, headache, and they sign their name to it, and that is sent to a registry somewhere. One of the things I worry about, and Chip was kind of alluding to it, I remember seeing a patient in March who had flu-like symptoms. I did a flu test on him and it was negative. And he said to me, I have to work. I am in every scene in this production. And I said, even though your flu test is negative, I think you probably have the flu, or maybe you've got, you know, COVID. We weren't really talking strongly about that, but it was in the back of my mind. And my advice to him and the production was that he needed to spend at least 5 days, which is sort of typical for the flu, away from everybody else. But I'm quite certain that he didn't do that, and I'm worried now in this new environment that people will they will still remain hesitant to admit that they're not feeling well. And you know, like Jill mentioned, even a runny nose now, like when we do screenings in the respiratory clinic, all you need is one of those symptoms that I mentioned, and runny nose is one of them. And so, you know, the advice we're giving people is, we assume that you may have it. We're going to test you for it. Go home and isolate yourself. And there's certainly going to be overkill happening. I mean, there's going to be a lot of people that just have allergies that we're telling to go isolate. And so, you know, we're sort of you know, how far along that spectrum of risk are we willing to go? And to me, it'll be interesting to see what happens in, you know, apparently IATSE had some guidelines that came out on Friday. I don't know, maybe Roger or Jill, you've heard of this. They apparently echo some guidelines that were put out by BEC2, which is sort of the UK's version of IATSE. Someone who has read them talked to me about them yesterday. I don't know, have you guys seen anything?
No, not yet, but I'm sure within this week, once they make it official, they'll expose it to us.
Yeah.
Let me, before we go on to that practicality, let me ask you, Chip, real quick. Tests aren't cheap, right? I mean, the tests aren't cheap. So when you go to, if we were to go on set, is there a practicality in having everybody get antibody tested? Is there a practicality in sort of like the temperature check, like, you know, and then sort of, you know, how would that work, I guess, when we talk about, you know, everybody lines up sort of at check-in, and do we test temperatures? So, and maybe you guys can also jump in on that. I think, you know, because when you think about, even now at check-in, we all line in, so that would be something that would have to be spaced out. And then if it was something where now we're also checking temperatures, going back to what Dr. Paul was talking about, it almost seems in a certain way like there's a declaration along that it's an extra page in the paperwork, and then we're all spaced out. It adds to the check-in time. And then, what is it in your sort of field, the requirement to go through and actually test everybody's temperature? Because that seems like that's a very grueling process.
I mean, the one thing that concerns me right now is I don't know if Dr. Paul, or y'all saw that, everybody was pushing the Abbott 5-minute test, which was next to nothing. Like we have Abbott machines in all our clinics, and we still have not gotten the test. But on Thursday, there was an article that came out that they're having a lot of issues with the Abbott test at this point. And so there goes the 5-minute test. I mean, I know like our stuff, it's basically, we're getting results in 24 to 48 hours. But I feel comfortable with the Quest and the Clarity test as far as their validity and their specificity of it and all that stuff. So, I mean, my thoughts are just kind of, if you're going to be on set on Thursday, you would have to have a window where you got tested prior to that, and you would have to self-quarantine for going up to it. I mean, if you're a principal actor and you want to work, you would take that, approach. But then it also goes back to how honest will people be about their self-quarantining, So, and I think like Dr. Paul said, if you're signing that declaration, I mean, I think that's kind of about the only approach I guess you could go. I mean, I do think there's going to be a group of us actors that are willing to work and go out there and do it. There's going to be a group that will say, no, I'm not going to do it till they have a vaccine or a cure for it. But I mean, last year, I'm in the clinic so much. Last year, I had flu 5 times. And so, and I've taken the flu vaccine, but it's never enough that knocks me out. I just go in my office and close the door and work in my office. But it's just, so I mean, even with a vaccine, there's no guarantee that you're not going to get anything.
Yeah, those tests are under a lot of scrutiny these days. Even the gold standard PCR test, which is the one you guys are using at Quest, have now some variable questions about their sensitivity too, and it partly depends on how early in the illness you do the test. But it's going to make it more and more difficult the more we try to rely on testing as the main way of screening people. It feels like it should be, and ideally we'd have a rapid test that you could do in a few minutes. That's inexpensive and everybody could get tested every day, but there's going to be a practical side to this that's going to temper that.
Yeah, we have one that's coming, like we're working with another company right now that it's all molecular, and they of course have flu right now, strep and all that, and you can get a positive in as little as 8 minutes, but a true negative I think takes 30, something like that. But we're kind of very hesitant to go with it. I mean, I took the antibody test, which was a blood draw, and mainly because I wanted to see what we were going to get back from Quest as far as disclosures and all that. And I'll be honest, when I got it back, I read their 2 paragraphs of disclosure, and I'm like, I wouldn't feel comfortable giving this to anybody, because it was like, well, you're negative, but you could still be positive. And if you're positive, you could still be negative. And I knew that if a layperson got that result, they would be like, why the hell did I even take this thing?
Yeah.
So what we're doing with people that come in that want to test for antibodies is we're pulling the blood for the antibody test, and then we're also doing the COVID-19 nasopharyngeal swab at the same time.
Right, because doesn't the antibody test only test for coronavirus in general? It's not specific to COVID-19? Yeah.
Yeah, so it's just, we're just trying to rule out everything, but it's just, because I honestly thought I had it in February. I was sick with high fever for 3 days, and I tested negative for flu, negative for strep. The interesting thing is when I first started feeling bad, I took a Z-Pack, and the very next day my doctor gave me Xafluza, which was one of the things they were trying in China for a good bit. But my antibody test came back negative. But, it's like, was it so long ago that maybe, you just don't know. There's so many uncertainties.
So Roger, is that something, obviously I don't want to put anybody in a situation where they feel like they're trudging on, an organization, but as far as practicality of the set and, figuring out a way to test everybody and that sort of a thing, is it something as an individual you're thinking about? As an individual, are you like thinking how to sort of like what would be done, that sort of logic?
Yeah, honestly, at this stage, because we're still so early in this pandemic, that to try to put together some type of formula that can work with something that's forever changing is we're writing our own death warrant. So if it means that it's another 3-6 months before we have some stability, my thing in the Commonwealth, we still have deaths happening. It'd be one thing if, we had a 2-week, 3-week where it's on such a downward spiral that, we may only have one death equated with this. And even to that, trying to figure out what was the precipitating factors with that person. Was it someone elderly? Like right now, the rash is in the nursing homes that are happening. Is it somebody that was, hey, I was a construction worker on the side of the highway and the group I was with? So we have to kind of understand where it manifested itself to begin with. And if we can go a good 2 weeks where we've had no deaths, testing is still happening, and hopefully, we're having honest negatives with that. We're in the phases where let's open up these certain businesses that we can feel comfortable, to even try to think about filming anything at this stage, because you have people that are coming from different regions of the planet. You may have someone on the West Coast, and as well as I do in New England, our weather is like spinning a dreidel. You have no idea where it's going to fall. Like today, it's 70. What tomorrow, it could be 50 with thunder showers. And then, we're used to that. But somebody coming from a hot climate may not be. And what happens, they become symptomatic with, hey, I've got the chills, the fever, and then could that spike the COVID issue again? Or just the fact that someone's panicking because that person is feeling sick. Do they quarantine before they get here? There's so many speculative mindsets of how do we try to do this? And my question is, what's the rush? If we're going to save lives, we're going to be very smart about how we do this. Then we have to play the waiting game until the area, worldwide, at least United States wide, we're at a lull, with this. So, but then once we get to that point, we still maintain the practices of proper hygiene, the cleaning, the wiping down, without getting too far to one side. Like with catering, let the caterers do the serving. With craft service, everything is packaged, almost like a food truck. Go to your window, say, hey, I want 5 Skittles, an M&M, and a Twix bar. You wait, it gets packaged, it gets passed off. Instead of having that feeding frenzy, which it's been documented, people dig their hands into the M&Ms and the next person. So right there, that's a breeding ground. So we have to minimize those factors in conjunction with, hey, not because we have a vaccine, it's a free-for-all. No, what brought us to this point? And like I said, when I digress back to basic hand washing, what does that tell you? We have to maintain that consistently. If it means adding more wash station hands on set, prior to coming into set, outside of set, near the bathroom, and almost in a visual aspect, because someone may go into the bathroom, use the bathroom, they come right outside. Now, if you put that wash station someplace where I feel comfortable because I saw you go and wash your hands, that's a positive. Versus, as most people say when we were growing up, why is your hair dry? I took a shower. No, your hair is dry. You didn't get in the shower. Get back in there. So it's going to be, self-accountability, so someone can be, and I'd rather someone be obnoxious washing their hands, almost like Dr. Paul going to surgery where the hands are up. It's like, look, I'm sudsed up, wash and go. And realizing it's for the good of everybody. So as far as, trying to get involved with on set at this juncture, I would be a negative, nope, not going to happen. Let's just wait. Let's stop the dying first before we even think about doing that.
And I think that's really important because, again, I think that a lot of people on Facebook, you can go down the rabbit hole of comments and thinking this without talking to somebody who actually has studied any of it. And, I think on that piece about catering and not sort of getting into the weeds on this, but like Jill, could you see a situation where maybe people go to a fitting and they also go and they get their temperature checked and they get all of that sort of thing, and then they're told, okay, now go home for 14 days. We're going to film in 2 weeks. Is that something you could see?
I absolutely can see things like that happening. I am curious to see what the powers that be will come up with for a solution for this, because there is a lot of legality involved in this. There's a lot of insurance things involved with this, with, like, is someone self-identifying that, yes, I've quarantined for 14 days, or yes, I've quarantined for 5 days, whatever the time limit is set to be. Are we taking people on their words? Is that, holding everyone else free from any trouble in terms of like insurance and whatever? So it's like, I know that on the set medic level, we might have the authority to say, I've taken your temperature, you have a fever, you're going to go home. We might have the authority to send people home and things like that. It might be someone else's job who does that. But as I've said because I've been approached to do temperature checks at like construction sites and stuff. And I try to explain temperature, as we said earlier, is not the only indicator of illness, whether it's this illness or any other. It's not a foolproof method of making sure people aren't sick before they go. So yes, I mean, it's not a terrible idea. We absolutely should do it because it doesn't hurt anybody. There's no harm in doing it. But it's not going to catch everyone who's ill. So therefore, I don't want anyone having a false sense of security thinking, I had my temperature checked this morning, I'm fine, I don't have a fever. And then who knows what happens. But it's possible that you're right. Someone could go for a fitting. They could possibly get a test or have a temperature check. And then if they agree to isolate for whatever the time frame is that they're told, they could all show up to set and work. It's possible that might be a way to do it. Like I did hear that some people were going to dress sets in advance and let them sit for 5 days. And then the crew would come in and work on that set. And it would be like that, where things would be set up well in advance and left to sit so that any viruses would die before anyone goes in and actually works there. Ventilation is actually one of my biggest concerns because the sets that we all work on are poorly ventilated, if at all. Or, I mean, sometimes ventilation can aid in making sure that viruses don't spread. Sometimes, the lack of ventilation aids in it. So it's like, we need to take a really hard look at the places that we're going to film in, so that if there is anyone who's been exposed, we make sure that no matter how much you're washing your hands, it can still, they're tough. So it's, I'm willing to do whatever is deemed necessary down the road, but I think that we have a lot to figure out before we get to that. But temperature checks alone aren't going to be enough, I don't think, in my opinion.
Well, and that's sort of something that I wanted to address. And Chip, I think you're in the same sort of boat as me. We want to work, right? So it's something where it's, we're all anxious to figure stuff out, and there's a feeling from everybody that we want to get back to work. Now, obviously, it changes from state to state, and you being one of us who is out of state, it's sort of that feeling, right? The membership wants to work as far as us as individuals.
Yeah, but I think it's still too early in the game to really understand like where people are going to fall with it. I guess because haven't really stayed home since day one with this. I've been in the clinics those first few days, and Dr. Paul can probably tell you this. The information we were getting from the CDC and the Urgent Care Association of America, it was changing like every hour. But now we've got a little more stability with the way things are. But the problem is the average lay person actor that's not in the clinics isn't going to have maybe the comfort level that I have as an actor / somebody that does his day job in a clinic, So it's just, I think that when they move forward with whatever they decide to do, they're going to have to take into consideration those people's feelings and where they come. Like today, I'd go to work tomorrow. I'm not that worried about it. I mean, my gym opened up yesterday and I've been in it twice. So it's like, it's just, I know there's a push to get back to work. I'm really interested to see how they do it. I mean, it's just because this is what concerns me is we're going to go back to work and there's going to be situations that happen and then everybody's going to be second guessing everything. And when you look at the whole legal framework of everything, that brings in a whole new dynamic. My wife is a defense attorney and she represents doctors in malpractice all the time. And if a doctor signs off on a set procedure and then something happens, you know there's going to be somebody that wants to sue them. And it's just, I think that's going to all have to be played out and figured out too. I mean, there's so many dynamics that are going into this whole situation that, I'd love to go back to work next week, but it's just, I understand their hesitance to do it so quickly.
And to piggyback on that and to sort of give Dr. Paul, I want to give you kind of like, not so much as the last word, but just sort of weigh in on that. Because I think what Roger touched on and everybody here is echoing is that sense of the caution and the we're not ready yet. And we all understand that everybody wants to work, but like somebody like yourself who is hired to advise, what is your feeling? And then again, sort of echoing on what Chip and Jill and everybody has mentioned is, that we don't want to be wrong, right? So, what is your feeling? What is your take on that?
Well, I'll tell you, there's a person that I turn to sometimes on health-related issues in the film industry, and I think Roger, or maybe Jill, you guys know her. Her name is Monona Rossell. She's about 85 years old, and she's almost an iconic figure in film safety. She's like the safety officer for United Scenic Artists, the IATSE 492 or something. And so I spoke to her not long ago, and she's very conservative in her take. I mean, it's part of the way she is, and so you can sort of expect that kind of answer from her. But she said to me, it's the question about money or your life and health. And in her opinion, it's not worth it. But however, the thing is, when you really think about those two concepts, health and life and money, they're interrelated. And what has to happen is a consensus on the tipping point for when the amount of risk is acceptable, because there's no way to make it 100% risk-free. I think an interesting experiment will be the Tyler Perry productions, which are in Georgia and are soon to be, if not already, starting. And, some of the things they're doing are testing every 4 days on people, on cast and crew. They're spending a lot of money to err on the side of caution. They're sterilizing. All the food is prepackaged, and then it's put through a sterilizer. Those are just a couple examples of trying to minimize that risk as much as possible. My sense in general is that people, at least in Massachusetts, just sort of a gut feeling is that they're not ready to take that risk. Part of it is because the curve for Massachusetts needs to come down. I mean, we're seeing fewer cases. We're still seeing cases, and we're still seeing deaths, like Roger mentioned. But we're not quite over the hump yet. So tomorrow, the governor will give us some more information about what's going to happen. Supposedly the 18th things open, and tomorrow we'll know a bit more.
Awesome. I just want to, again, I'm going to pause the recording in a moment, and then we'll just talk real quickly. And I have some minor stuff, but I just want to thank you all for being a part of this discussion. It's your insight, the years you've spent in school, I really appreciate your friendship. I appreciate the knowledge you have. And I just go back to that sort of calling on friends who actually know, and not getting in fights with people that don't really have that knowledge. I think in my life, it's a waste of energy, but you know, obviously it's different for everybody else. A lot of people have fun with it. So I just want to thank each of you for coming on and talking about this stuff. And if there's anything you want to sort of say last minute before I cut, I'll you know, we can go around or whatever, but I just want to thank you for an intelligent conversation.
Yeah, and thank you, Chuck, for putting this together and trying to get the conversation a little more nuanced. I appreciate all the efforts for that.
Thank you.
Yeah, me too.
Thank you.
Thank you, Chuck.
So I'm going to pause right now. Recording. Then, all right, Dr. Paul, if you want to go first. Let me.
Okay. My name is Paul Heinzelmann. I'm a primary care physician and urgent care doc at Massachusetts General Hospital. I have some training in public health, master's in public health, and a fellowship in telemedicine. I started a business called SetMD in 2007 to provide health-related services. To date, we've served over 150 productions and looking forward to finding ways to help with the coronavirus situation.
Thank you. And don't feel like you need to stay on unless you want to. So let me switch up now. Roger, you want to go next? So let me unmute you actually. Sorry, my bad. Okay.
Roger Dillingham, local site medic. My EMS experience is coming up on 29 years, 17 on rescue, and I converted over in 2007 to entertainment medicine, we'll say. Also a SAG-AFTRA actor, started about the same time. So I have the pleasure of being on both sides to see the spectrum of how this COVID-19 is affecting both cast and crew. I've had the pleasure of working with Dr. Paul on numerous sets, dealing with, you know, from stubbed toes to major injuries that we've been able to work together. And I'm very humbled to be able to entertain his experience that, you know, heightens my awareness in this ever increasing, changing medical field. And that's pretty much it. Looking forward to, you know, getting back into this as safely as we can for all involved, you know, especially for us on sets and when we go back home to our individual respective families. And that's it for me.
Okay, awesome. Let me get Chip. Let me unmute you. Okay, and then just give it 1 second to get the camera on you, Chip, when you start talking, and then go into it.
Okay. Hi, I'm Chip Carriere. I'm a SAG-AFTRA actor, but I also, most of us have to have day jobs. I've had numerous years in the healthcare field, both as a pharmaceutical rep for 12 years and mostly in administration. And I currently manage 8 urgent cares. And I'm just interested to get back to work, but also wanted to kind of give some input on what we're seeing from the ground level in the urgent cares, where many people come as their first line of treatment.
Awesome. And then Jill, I'm gonna unmute you.
Hey, I'm Jill Taylor. I am a set medic and construction medic in the film industry. I have a Bachelor of Science degree from Northeastern in biological sciences and technical communication. I've worked in the film industry here since 2000, so 20 years off and on. I am a member of IA and also a member of SAG-AFTRA. And I've worked in the assistant director's department for many of those 20 years that I've worked in the industry. So I have really strange background, but very science-based. So I understand the unique situation that we're in terms of figuring out how to work safely. And I'm looking forward to getting back to work when we do.
Awesome. And then Roger, you want to just go one more time, because in the beginning it wasn't on you. But let me unmute you. Oh.
For safety.
Hold on. Yeah. Okay. So go ahead. Yeah. Safety.
Roger Dillingham, local IATSE set medic, as well as SAG-AFTRA. I've been at EMS for 29 years, 17 with rescue, and the rest of the time has been on set, also in the acting world, and looking forward to trying to be as instrumental in this field as possible, having worked with Dr. Paul on numerous film sets, from stub toes to, you name it. Also have working with Jill on a few things, as she's been in this for a while, but now is taking a turn to come to the dark side, as we say, as far as being a set medic, which can be very rewarding. But like I said, our first priority is everyone's safety on set, and when we get back home to our loved ones and our respective families.
Incredible. Let me unmute everybody. Okay, sweet. Is everybody unmuted? I don't know if everybody...
I think so.
Okay, cool.
Can't
All right,
tell.
yeah. Awesome. Let me stop the recording.